Hi, I'm David Ashton from the BOH Dental Group in Brisbane City, and I'd like to take a few minutes to tell you about some of the aspects of dentistry that have changed in recent years. The progression of bonding techniques in dentistry has provided some real gains for our patients. For instance, when a patient needs to have a large filling replaced or a large piece of tooth is broken off, they often need to have a crown placed to restore the tooth to its original health. The problem with this is that sometimes, well, not sometimes, but most of the time, a large piece of good tooth structure has to be removed so the crown can be placed. And therefore, the tooth is weakened to a certain extent. Scientific studies tell us that the more tooth structure that can be retained on an individual tooth, the longer that tooth will remain in the mouth. So it makes good sense to not cut off tooth structure that is healthy. So to illustrate how these new restorative materials work, I have here a cross-section of two teeth, an upper tooth and a lower tooth. Now in a standard filling, it usually goes through the centre of the tooth like this. And this standard filling then causes sometimes weakness down here. And how this happens is easily illustrated by the fact that we have some food when we're eating between the two teeth, and what that food does is it applies a force, particularly if it's a hard food, applies a force on this part of the tooth which causes down here a weakness to occur. And sometimes the tooth can crack off, or just the crack can remain and give symptoms. So we need to try and strengthen the tooth to stop this happening. And the way we can do this using these hard industrial porcelains is by taking a couple of millimetres off there and a couple of millimetres off there and covering this area with this filling as well to strengthen these areas of the teeth. So then, when we bite on some food, the force is taken here in the porcelain and it saves this cracking off down here. So, if we have this diagram again, but this time we put a crown on the lower tooth, which is what usually used to be done to strengthen or protect a tooth and make it back to its original health. Here we have the crown here, the blue area, and this part of the tooth here is the area that the crown sits on. So as you can see, these large pieces of tooth structure here, all this and all this is removed to do the crown. Whereas with the other sort of restoration, we only needed to remove that much tooth across the top. And that is very good because the scientific evidence tells us that the less tooth that you remove, the longer the tooth will stay in the mouth, which is really good for you.